I'm the commander of Charlie 181 Brigade Support Battalion, the Brigade Support Medical Company. So, as a commander, I'm in charge of the 107 medics, x-ray techs, lab folks, doctors, nurses, physician's assistants that we have to run what we call a Roll 2 medical treatment facility. Comes with a complement of a platoon of ambulances, whether they are the MEVs, which is the Stryker variant, or the classic Humvee.
Right, to the right.
So we created a scenario where the Alpha Company sector was hit with fire. They successfully returned fire, and then were able to administer tactical combat casualty care to their 4 injured soldiers. They then evacuated them to a casualty collection point within the Atlas sector, called in the 9-line medevac, where one of our strikers came and picked it up with some members of our evacuation platoon.
Priority number 2. He's still responsible.
They then evacuated them around our ring route within the Brigade Support area to the Roll 2 medical treatment facility behind me, where we triaged what was for us a mass cal situation, which just means the number of patients exceeded the number of beds that we have at any given time to treat the patients.
Today we're doing a sort of a pseudo-mass cal trauma training with our medics, both from our evacuation platoon as well as our treatment platoon. What I did, my role in this particular scenario was really to serve as sort of the facilitator, where I'm giving the prompts to the vital signs, the injuries, because obviously we don't have high fidelity trainers here. If I was doing this in the real role, what I would do is I'd be supervising both the beds plus the patients out there, like Major Guevara was doing today, where I'd be keeping kind of overall situational awareness and really only stepping in and do a procedure if one of my other providers is unable to do it successfully. Otherwise, I'm keeping kind of a global awareness, and that way I can divvy out resources when they're scarce, including like blood products. When there are limited resources, kind of have to decide who gets them and who doesn't in some cases.
His heart rate is 130.
The horn I like to toot with Charlie Company is the vast majority of these folks perform medical, whatever their jobs are in the real world. So we've got a vast amount of experience coming from hospitals, doctors' offices, patient administration from across Washington. So I think we bring a lot to the table that's really unique about the National Guard.
One of the challenges that Army medicine faces is getting enough real-world reps, especially as conflicts die down. We don't have the opportunity to practice. The worst part of our craft is when we're dealing with sick and hurt soldiers. So getting to be able to do the job in the civilian sector really helps prepare us for the real-world missions. It's so important and so valuable to have these young people that come and volunteer to help serve our country. I'm continuously amazed. I mean, 20 years old, going to college, coming out here, training, trying to get better. They're so hungry to learn, and it's a real pleasure to work with them.
It's a fantastic team. We've got a bunch of winners out here, and they really just want to train. And it's fantastic to be able to set the conditions for soldiers to do what First Sergeant motto is, which is unleash your initiative, right? Anything I can do to set the conditions for the junior-most soldier to see something, act, and take their personal initiative and execute my intent. And that's what Chiron Company is all about.